our research agenda and improving the medical education of our learners. One of the things that is not in the PowerPoint that we'll talk about and look at today is the breakdown for the time period and the measurement of outcome and the responsible units. That is in the final draft of the strategic plan, and that has been delineated. But for the purpose of time here, I really want to make sure that you're aware of the 32 strategies, that you see them, and then we can get some real feedback from you tonight. So there are 4 goals and 32 strategies. So it comes out to around 8 strategies per goal. And the first goal is promoting an inclusive environment, promoting a culture of inclusion for students, faculty, and staff, promoting a welcoming environment. And what you'll see even from these 4 goals, a lot of this is not rocket science. It's not the goal itself to promote culture of inclusion or increase the diversity recruitment for students and faculty, but it's the how you do it. And that's where the identity of the College of Medicine inserts itself. That's where your voice is heard. How are you going to do a pipeline program? How do you want to have an impact in the community? How do you want to formulate your curriculum so that it meets your needs of cultural competency and health equity? Goal 2 is increase the recruitment and retention of underrepresented minority, socioeconomically disadvantaged, and first-generation college students to reflect the community of Ohio served. Goal 3 is increase the recruitment and retention of women, underrepresented, and diverse faculty, staff, and administrators over the next 3 years. And these are in line with the LCME Standard 3, Element 3 accreditation standards, where we are charged to have ongoing systematic recruitment and retention activities surrounding improved diversity outcomes for our students and faculty. And then goal 4 is to significantly enhance the diversity and inclusion education, the cultural competency education, the health equity education, and professional development for every member of the UT College of Medicine and Life Sciences community. And again, this is also in line with accreditation standards. So some of these things are not as if we're reinventing the wheel or starting from scratch. These are standards for every medical school to have basic principles of cultural competency longitudinally implemented within the curriculum, and to address things such as social determinants of health and health disparities within the curriculum. So let's just get through the strategies and talk to you a bit about the examples that we're seeing in real time with some of our student participation and our faculty involvement, things that are new and things that have been ongoing. Following the approval of the plan, which is in the next few weeks, we did present this to the faculty council and to the faculty, and obviously we're presenting it to you. We presented this to the dean. So we take the input from all of the stakeholders when we're in this final stage of the plan. But following the approval of the plan from the dean and the president, we want to ensure that we have a comprehensive calendar of events which reflect the culture of inclusion, which we are hoping to promote. So that has a lot to do with the multimedia presence, what you see when you walk around campus, who we are inviting to campus, what events we are promoting that include multiple dimensions of diversity, so that when even a student is visiting our campus, they can see themselves reflected in the way that we say who we are. When a student is accepted and is walking through the walls, through the halls of this institution, walking up and down through the libraries, in the classrooms, that you see yourself, that you feel welcome, that you don't feel like an outsider. One of the things I always say to students is that it is very important that you don't walk around feeling like you're a guest in this house, that you really feel that this is your home, that this is your house. And depending on the background, we talk about underrepresented minorities and social economically disadvantaged groups. First generation college students, for example, it's not a given that when you walk into a medical school, when you walk into a hospital setting, that you feel that you belong. So we have to be really strategic in the ways that we promote that. And then how do we support the groups that are already in existence? One of the really nice things about this College of Medicine community is that you have a lot of student organizations and a lot of support and a lot of participation, and you have your own agenda. So one of the things that is important for me is to support the student organizations which have an agenda all their own, to contribute to that agenda, but to also just support the activities, the community endeavors that you have throughout the academic year so that you can reach your own personal goals and strategies for success. We've had a lot of community engagement. The Barbershop Initiative has been very successful. The Latino Medical Student Association has done quite a few fairs, health education fairs and preventive fairs in certain communities. So we're trying to first identify and support. There are some dormant student orgs which we've identified that we want to help support. There's a desire to kind of reinvigorate those organizations. We want to give you the tools to make that happen as well. A climate survey is pretty standard, but having conducting the annual assessment of checking in where we're at and where we want to go in terms of assessing the needs of the students and faculty. And then supporting the Dean's Advisory Council. The membership of the Advisory Council will not fluctuate as much with faculty. Some of the faculty members will be here to stay for several years. We do have some new faculty members, but some of the leadership of the student orgs and some of the student participation will obviously fluctuate depending on the level of commitment that you have at certain levels or certain years as students. So we're always welcoming new students to this advisory council. The leadership, again, of these organizations tends to fluctuate, so that has a big impact. And then we've had women in medicine forums. We want to encourage more open forum discussions so that we can create opportunities for engagement and collaboration amongst the members here. The way you start something is the way you often finish it. So one of the voids that was noticeable when we were looking at the orientation is that there wasn't a big imprint for diversity and inclusion introduced from day one. So if you introduce our efforts and initiatives 3 months in or 6 months in, you kind of, miss the boat. So when you're first coming onto campus and first getting your sneak peek into the curriculum and you're first getting introduced to the faculty, that is the opportunity for the Office of Diversity to introduce some of the ways that you can get involved, whether it's through organizations, whether it's through supporting our plans moving forward. So again, you feel from the beginning that you have a voice and that there is a way to get involved from the beginning. And then even in the sense of support, what are the supportive services for me as a student, for example, walking into this institution? How do I know where to go? Where can I go for support? Who's there to advocate? And that shouldn't be a question from day one. So this is a way to kind of implement some of the required segments from the beginning and try to implement those in the orientation. And then one thing that's when we talk about awards and recognition, there are a lot of efforts that have been ongoing and some plans moving forward, but we want to make sure that we award the students and faculty and staff that are involved in some of our diversity and inclusion efforts. so that it just isn't lost in a void and just kind of cocooned in a certain segment. So it's applauded and highlighted as a core value of the institution. And so when you are even, and that's not as addressed here, but later in the plan, but even when it comes to promotion and tenure, that the activities for faculty that are related to promoting an inclusive environment, that are related to mentoring, that are related to implementing diversity and inclusion into research, for example, that those are tied to your promotion, that it's not just an add-on or something that you're doing on the side. This is integrated into something that will have a direct benefit to you professionally as a faculty member, and that provides added incentive for all of our members. Okay, and then also, again, this goes along with the calendar of events, but making sure that we have a speaker series that highlights some of the leaders within the institution. We had Dr. De Silva, who's the chair of pediatrics, speak earlier this year as our inaugural Language of Diversity lecture series speaker. One of the nice things about his talk on an evening was that we had our med students there, we had our faculty, but we also had area TPS students and their parents present. We had some of our undergrad students and a couple advisors present for his talk. And that just ensures that we are communicating that we are part of the community outside of the four walls of the institution, that he's here as a mentor, not only for our medical students, but for those who are just even mildly contemplating a career in the healthcare fields. And he's a mentor and here for advising and guiding those students who are just at the very beginning of interest in these careers. So it's really important that we highlight speakers within and then also invite guest speakers from without. We will have Quint Capers coming in, who's a national leader and speaker on issues related to implicit bias and implicit bias training. And it's important that we invite those who are real trailblazers in some of this work to our institution so we can learn from those who've been doing this for several years. We're guided by our metrics. When we look at our first year class and we look at some of the demographics, we have to kind of see where we're at and then where we want to go. We see about 2% African Americans, 2% Hispanics, and we need to enrich and fortify our recruitment efforts so that our student body better reflects the demographics we serve, for example. And that brings us to our next goal, to increase the recruitment and retention of underrepresented minorities, socioeconomically disadvantaged, and first-generation college students to reflect the community served. And we tend to barrel towards recruitment. How are we going to recruit? But you recruit who you first attract. So you want to spend the time to ensure that this is a welcoming environment, that this is an inclusive atmosphere. You want to support new organizations, White Coats for Black Lives, for example, which had almost 200 participants signing up for membership. You want to ensure that this is a place where you can find a voice and that you will be supported. So it starts with attracting, not recruiting. People are drawn to places that have that inclusive climate. And then once you get students on board and accepted and into the community, how are you going to support them across the graduation stage? So it doesn't start and end with your acceptance letter. And once you're here, how do we support you in achieving some of your personal and academic and professional goals? And then those people who feel supported tend to want to stay. So it's a shorter bridge to cross in terms of feeling supported for however many years you're here, and then wanting to stay on to a community that has welcomed you. And so a lot of there's a lot of interest in pipeline programs and how you can fortify those pipeline programs. This REACH program, which started yesterday, um, has been in place for 15 years. So there are relationships between our faculty and the gatekeepers at some of these schools. And that is an advantage because they can help to identify students early on who are interested in medicine, for example, and then kind of usher them into a program such as this. One of the things we want to do is expand the numbers. And another thing that's really important is that we ensure that the students who are in these in this program are kind of fulfilling our diversity categories. So we want students who are social economically disadvantaged. We want minority students and students who would be the first in their family to go to college. We want those numbers to reflect 100% of the participants, so that we're not kind of watering down our resources or straining our resources and not delivering them to those who really will need them the most. REACH is a summer program, and traditionally the students in this program would shadow, so they would be on campus. And obviously, with everything related to the pandemic, we've been able to innovate and make this a virtual program, which is still quite effective, because one of the things you have to realize is that there's a broad disparity in access to the medical community outside of being sick. So you may not have an opportunity to listen to Dr. Aquina or to meet medical students who will tell you about their frustrations, their failures, their roadblocks, obstacles in getting into medical school. You may not have people who will kind of talk to you about how to apply for financial aid or college, how to manage your time, set goals, etc. So this, even if it is virtual, is goes miles beyond what you would have otherwise. So we're very, very thankful that the numbers almost doubled from last year to this year under the virtual format. And the need is still there. The need is still alive and well. So, and then another thing is the participants who have helped with REACH has tripled. So we have quite a few students and faculty who have signed up and said that we want to be a part of this program and mentoring and guiding and just letting the young people in the community know that we care. And then strategy 2 has a lot to do with um, once you accept students who are in certain groups that have been underrepresented and underserved, you don't want to just accept and not get the support that they need to be successful and to feel that support. So one of the things that is really important is mentoring, big brother, big sister mentoring from upper class students to incoming students. A pre-matriculation workshop has been kind of broadened into a week for this year, and it was traditionally one day, the Saturday before orientation. The students would come in, meet tutors, meet some students who were upperclassmen, and then connect and get some type of roadmap or tips for success. This year, we broadened it to a week so that each day there's some faculty coming in, giving some insight into the curriculum, some assessment in terms of learning, study skills, inventory through Lassie, and then also some hearing for this is how you should, or some recommendations for how you should implement your study plan, for example, so that when you come in the door, you're not trying to waste those few days of just trying to figure out what would work. You have at least a roadmap from those who've been successful before. And just that this is a support that would last throughout the years. Through this early intervention, we will be pairing incoming students with faculty support. So faculty student mentoring is also a part of that. One of the real promising efforts that we have is with Toledo Public Schools, and we'd like to expand our, we have the program here starting in junior year. One of the latest drafts that we have is really trying to expand this to pre-K. So kind of elementary school where we are having some interface with from our faculty and our students with the earlier years so we can have a more significant earlier impact on students who are interested in medicine. And then one thing, again, when we talk about attract, recruit, support, retain, scholarship support is a big concern. How can you compete with other colleges of medicine who are offering scholarship support and funding if you're offering minimal amounts? So one thing that has been a real benefit of the affiliation has been the creation of new scholarships that did not exist before, and some of the scholarships that we've been able um, to align with our diversity goals include Mission Forward, Diversity and Excellence, Hope and Commit Awards. And in this next cycle in 2021, we will be significantly increasing the number of scholarships and the amounts that we'll be able to offer our incoming students, which will be helpful. We're also developing partnerships with our UT pre-health advisors so that we can have some earlier support and academic guidance for students who are coming in as freshmen from these certain groups as well, so that we're able to intervene and give some mentoring guidance before they're actually at the point of applying for medical school during their junior and senior years. And then we're also aiming to increase the support from the Academic Enrichment Center. The AEC is involved in the pre-matriculation workshop that we spoke of earlier in a way to make sure that there's an introduction of the services before the house is on fire. So before things are falling apart, that you know where to go in terms of resources. That includes Office of Student Affairs, AEC, Office of Diversity, etc. And one thing that's been really successful in the midst of COVID is the virtual mentoring program. Me Mentoring has been a real successful program, and this enables our students as well to have a national platform for recruitment. And even in the midst of COVID, there have been 4 webinars that have addressed anything from how to get into medical school. I think some of the upcoming sessions will deal with how to deal with the interview, the mini interview, and how to just make yourself more competitive as an incoming student. And then it helps to speak to students who are currently enrolled to kind of talk in a transparent way about some of their challenges and hurdles in real time. It's one thing to look at a website, it's one thing to look at a YouTube video. You can ask a current student, what are the challenges? What are the things that you're happy with and unhappy with? That goes miles in terms of promoting a welcoming environment. One thing I'm very proud of in terms of the Second Look program is that for a lot of the students who made their commitment to come to UT this year, it was more like their 20th or 30th look, because the current students had some interface, whether it's in group chat with them or a dinner prior to their interview day, where they were able to introduce themselves. I am a second year, and I am involved in this. And so by the time spring rolled around, they had become more familiar with who we are and what we represent, what we have to offer. And I do think when it comes to recruitment, people tend to go where they feel supported and where they have relationships. Those relationships could be just geographic. you're from Toledo and you want to stay in Toledo. Those relationships could be built, could have been built from an interaction during interview season, or attending a conference, or being in a group chat. I mean, there are different ways that you develop that relationship. And then the support just naturally springs from that as well, so that you feel that when you get here, you will have the support that you need to not only survive, but to thrive, which is important. And then that brings us to goal 3, which is to increase the recruitment and retention of women, underrepresented and diverse faculty, staff, and administrators over the next 3 years. And our first strategy here is really to create a program that trains departments on recruitment strategies to attract faculty for underrepresented groups. We've been working with the Office of Faculty Affairs and Development in ensuring that we have enhanced mentoring opportunities for new faculty and career development for underrepresented groups. The programs that we have for these mentoring, and I'm going to strategy 6, for these mentoring initiatives have been mainly focused on women, and we're in the process of trying to broaden that scope so that when underrepresented groups, faculty are offered positions, that they are also paired with mentoring support from the beginning to ensure more success. Our search committees have been diverse, and so we want to continue to support and ensure the diversity of the search committees, and advertise openings for faculty and staff in publications targeted to diverse populations. We had a pretty significant revamping of the faculty recruitment policy. And what that means is that there's a tracking of applicants. So if there's a position that's available, previously it was available, there was applications for that position, and it streamed on through. There are certain stops in the process first to ensure that once the position is available and that there's an applicant pool, that the applicant pool is diverse, whether that's with women, underrepresented groups, so that the pool is diverse. If you don't have a diverse pool, you have very little hope of recruiting diverse faculty. So there are certain hard stops in the process, and that first one is big, so that the applicant pool is diverse, and then the applicant pool is looked at through the Office of Faculty Affairs, Office of Diversity, and then in terms of the interviews, that is also assessed in terms of who you're offering interviews to. If you have a larger pool and certain positions, is that interview pool diverse? And then there is a final approval of the offer, so that the most qualified applicant is given that offer, but that we're also always keeping in line with our diversity initiatives and our diversity goals. So that it's not working, so that this office is not working in a vacuum apart from faculty recruitment. Faculty recruitment is over here and diversity is over there, but that we're working in alignment. One of the things that is we're proud of is that we want the chairs to feel comfortable asking for help and assistance. Where are the resources that will yield the best results for recruiting a diverse faculty? These things don't just appear out of nowhere. They need to have, the different departments have different departmental needs, but have some guidance in where to advertise or which organizations to reach out to ensure that we're moving towards this goal. And then we also want to support the students and faculty in their research opportunities. One of the benefits of diversity is that it broadens your research agenda. So we want to support students and faculty in professional development activities, whether it's hosting a conference, which we were very fortunate to do, Student National Medical Association, SMA, hosted for the first time in 15 years the Regional Medical Education Conference for Region 5 in the Midwest, and hosted hundreds of students here. We also want to support our students and faculty and conference attending throughout the country so that we're able to put a face to the commitment that we highlight. We're able to say, this is our student, this is our ambassador, we support him or her in their research initiatives, and we're sending them out to California to present at this conference. These are the types of things that we want to promote and encourage. And again, rewarding faculty and staff and participation on some of these committees and as faculty advisors for these organizations is key to our success. When we look at our final goal of enhancing diversity and inclusion education and professional development for every member of the College of Medicine and Life Sciences community, one of the most important aspects of building a comprehensive cultural competency curriculum is to ensure that we have the stakeholders at the table. That includes students, faculty, senior administrative positions at the table, making sure that this curriculum meets the needs of our students. One of the things, we had a MSBS marathon of interviewing a couple months ago because we had to, in just a couple days, do all of the interviews and for all of the students in a short period of time due to COVID. So we weren't able to do the in-person interviews. Everything was virtual, but we were crunched for time. So for me personally, I did 9 interviews in a row. And one of the questions that came up was related to cultural competency, and if you as a student were if you were implementing a cultural competency curriculum, what would be your preferred strategy, or what would you think would be a strategy for successfully implementing this? And each student, when they were tasked with what their first steps would be in creating this type of curriculum, each said that they would want to get some input from those who were affected the most. So whether that is through patient panels, whether that was having an actual diverse student body where the input from that curriculum is coming from those who are experiencing certain challenges and disparities, racism, et cetera, so that they're getting the input from those who are actually experiencing the challenges. And each person, 9 in a row, each said the same thing. And so I was really proud to have one of our members, residents, Kingsley Joseph, have the courage and right state of mind to get in front of 175 students on their way to their clinical years during Bridge Week and share his story and talk about his challenges. And I found it really powerful. That's why some of the work that's done in barbershop initiatives or health education fairs and free clinic, where you're coming outside and you're going into the communities, or you're bringing the community inside to tell stories and have an impact on your education. That, I think that's really key. But this task force is newly developing, but the priority for implementing cultural competency has been there for some time. So there are quite a few pieces that we have in the puzzle before we even have the first task force meeting. There are quite a few directions in terms of where we're going with this and how we can get some of these things done. So we don't have to really start from scratch or start from a blank slate moving forward. So developing and implementing a core curriculum on diversity and inclusion is a lofty goal, but it is a completely feasible and reasonable goal, I think, One of the nice things about the actual plan, and I know you're seeing just a segmented version, is that there are time frames for what are the things that we can do immediately, what are the things that we can do in 3 and 6 months, what are the things that will take 18 months, what will take the full 3 years. The Office of Multicultural Student Success has been implementing 4 diversity workshops for years, which deal with awareness of self, implicit bias, understanding of systemic racism, institutional racism, for example, and then awareness of others. So it kind of goes through 4 workshops, which are 90 minutes, and kind of engages first self-reflection and then how you perceive the world and how you're able to meet the needs of the patients that you serve. So that's one thing that we will be implementing immediately, for example. And then there are some things, again, when it comes to the way that we're training, the way that we're arming faculty to have the capacity and the knowledge base and the funded knowledge base to offer some of these elements in cultural competency may take longer because we're not just trying to check off a box. We want to make sure that the work is meaningful and impactful. Um, One of the best strategies in doing that is in training the trainer opportunities. I've been a part of those and we'll be able to give some diversity training and implicit bias training to other students and faculty here. And the more of members of our College of Medicine community who engage in training the trainer opportunities, obviously, the more complete and comprehensive we can ensure our students and faculty receive that training. There's obviously always a limitation in resources and staffing and opportunities, but the more engagement that we have in terms of those who are able to facilitate these discussions, the better. We also want to ensure that there is diversity training for all of our faculty. And so Dr. Duggan has really been working quite a bit in terms of making sure that we have mandatory diversity training for all of our faculty. We've had a certain tier in terms of the EverFi and then kind of um, raising the bar in terms of what is mandatory for all of our faculty. But when it comes to chairs and program directors, we also want to make sure that there is face-to-face diversity training workshops available to ensure that there's the most impact. This is, it's really important that as we're pushing um, towards broadening research and broadening the research agenda, that there are also incentives for individuals to publish scholarship on diversity-related topics. Some of those incentives are related to the way that this matters in relation to promotion and tenure, and that it is highlighted as a priority from senior leadership throughout the college. And then we're getting towards the end of this goal, but service learning opportunities are key. I think part of the uh, limitations of classroom understanding of these issues is that you're kind of just interfacing with one another. And there's something real about moving outside of these 4 walls and interacting and listening that is quite powerful. The REACH program, for example, is an opportunity for our students to engage with the surrounding students and share the stories and help to empower these students so that they feel that they matter. There's a student in the REACH program that just started yesterday, a young girl whose brother drowned in the last week. And she is still showing up for a summer research program, summer enrichment program. And I find that striking because I can't quite imagine myself doing that. But I also wonder where the push is. Is this push coming from herself? Is it coming from her parents? Is it coming from someone saying, this is an opportunity for you and you need to engage in this opportunity. You may not meet these students. You may not meet these faculty members again. And it's uh, it's really moving um, and kind of painful too, in a way, when you think about the idea of a young person grieving in the midst of all of this and feeling that if they don't possibly take advantage of this opportunity, they may not have another opportunity. The feeling of, I have to grab onto what I have, or this this experience, because I don't know where I'll have, um, the backup or the support that I need to be successful. I don't know what all is going on through her mind, but I do know that it was striking that we have students who are dealing with trauma, whether it's something as horrific as losing a sibling, to just dealing with the trauma of facing images of racial injustice, for example, over and over, feeling isolated related to COVID, or all of these things that have just kind of widened the gap of access between the underserved populations, or even more underserved, marginalized and disenfranchised communities are even more marginalized in the midst of all of these things. So it really underscores the importance of service learning opportunities, which just means our students and our faculties moving outside of what is necessarily required, and making sure that they make that direct impact and difference. Okay, I I'm looking at the time and I see that the last time that I gave this talk, we went to a full hour, and I was going, and I see that we have gone almost to the hours. We have a good 15 minutes or so to really talk. So when that's the the core of the strategic diversity and inclusion plan. It doesn't give you all of the key individuals who are accountable for implementing the plan, or the timelines. It's not, which would be a longer discussion, but in terms of when this will happen, or what our goals are in terms of making these things happen. But it does give you a framework for the vision for the next 3 years. And I hope that you have made some notes in terms of things that you'd like to get feedback in, or ways that you could see yourself as part of this plan. I'm going to stop sharing the screen now so we can get to some questions. Some questions were submitted, and let's see. Okay, and so I want to see if, let's see something, if I can get to unmuting or opening it up to the chat. Let me try. Okay, if you have questions, you can submit on the chat, and then also let's see. Okay, if anyone has any questions, please put them in the chat, or I will answer some of the ones that were submitted earlier. Does anyone have any questions so far? And then you can raise your hand, and then we will call on you from the group. Okay. Okay, it's not the worst thing. Can we receive a copy of the PowerPoint? Yeah. One thing is you can have the copy of this PowerPoint, but one thing that would be really helpful for you is when you have like the final draft of the plan, because you'll be able to see a little bit in terms of the time line and the measure of outcome. One thing that's really important is how do you know that you're successful? You set goals and you set strategies. How, and you have to articulate that in a plan. How do you know whether you reach that goal that you set or that strategy that you set? So that's something that we want to make sure that every member of the College of Medicine has in their hands. Okay. Well, the final plan is pretty much complete. And it it is complete. I think the next step is in getting, we're also seeking approval from the president, and there's been transition there. And then our hope is to publish it so that it is, again, part of a culture of inclusion. If you're looking for a place where you can belong or that you have a voice, if you looked online, you would want to know what's your strategic plan for diversity, and you'd like to have access to that. Do we have data from REACH? And if those students decided to go into healthcare, we do have data from REACH. And so all of the students that have participated have to do a survey. They're only in the last several years have they been able to, I would say in the last 5 years, kind of look and see who is going into medical school and who is going into another healthcare field. We have several students who have eventually matriculated here, and then some students we've not been able to track in terms of where they go once they leave outside of the Toledo area. But one of our goals is to ensure that every student is tracked, whether it's that they're going into medicine or occupational therapy or whatever the deal is. That one other big hurdle is just ensuring that they get into college, because the students are also first generation. They will be first generation college students. So of course, we want them to eventually matriculate into medical school if that's their goal, or certainly stay here. But the success for that student is that they're also attending college as well. Yeah, we didn't get into it fully, but we also have a partnership with Bowling Green, which we consider that a pipeline program as well. Their AIMS program, which supports those who are interested in science careers. And we do have some data tracking that they're interested in going into healthcare fields, not necessarily medicine, but that they're interested in one of the healthcare fields. What are some of the specific changes that we will see in the preclinical curriculum? So there's two parts to that question. One of them is that um, the task force is important. The task force is not just a name only committee. This is something that has been talked about, and there's a lot of interest in participating in the curriculum task force. The majority of the members of that task force are all students. So that's a way also for us to ensure that what we're offering is meeting the needs of the students as well. Some of the things that you will see right away before we've even had our first task force meeting include things such as the OMSS for workshop diversity and inclusion training. And I think that will be really good. It's just like a foundation every student will have to go through that process where that process wasn't there before. The offerings through Bridge Week, the offerings of health disparity lectures, lectures on implicit bias. There are several different offerings throughout the year, but in terms of making sure that this is a comprehensive and fully integrated curriculum into the one that already exists does take some time, and because you want to make sure that you're thoughtful about that process and very intentional about it, and it's not just a sticker you're placing on top of a page. You're making sure this is not a band-aid solution to larger institutional issues. Yes, so will there be small group discussions integrated into this curriculum opposed to the classic lecture style? Yes, and Dr. Mattis would be able to also talk a little bit more about some of the learning pods and the plans for having these smaller group-led discussions to kind of unpack this information in a more meaningful way. Yeah, so there's SNMA suggested an anonymous reporting system for students such as BART. Will this be a part of the changes that are implemented? This is already, I had it written down. Um, there is, I'm gonna write this out here. There is an anonymous reporting mechanism in place. I believe that's correct. Sure that you put this in here. And this ensures that any member of the College of Medicine can report incidents through this system anonymously. And if there's a desire to report and identify, that's a way for you to follow up and see kind of what happened from that report, but and to get more real-time feedback. But there is an anonymous reporting system that's in place and it's available to the College of Medicine. Okay. One of the questions was related to diversity training, which we kind of covered, and it's really important that we reassess and check in with how that diversity training is going. So that's part of the benefits of having a climate survey. The diversity training online has some benefits because of ease of access and ability to disseminate quickly. Obviously, the ways that you can really engage in small groups and get real-time feedback and understanding, as we're trying to kind of build bridges towards each other um, in small groups, that's preferred and ideal. So when it comes to the types of diversity training that we're looking at or implicit bias training, ideally we would prefer smaller groups to make that happen. Okay. Any other questions right now? Okay, well, I really thank you for taking the time out tonight to listen to this plan. We will have a follow-up town hall maybe where you can have more time to engage and ask questions. I just want to share this one story since I was on call last night, and one of the partners in my group, I consider more like a big brother, Dr. Ali Hassan. And for years, I've worked with them for the whole group for almost 15 years. But for years, one of the things Dr. Hassan says, Ali says, almost every time we're putting the schedule together is, do not give me a healthy patient. He says that time and time again. Do not give me the healthy patients. I don't want the healthy patient. He said, I want the sickest patient. Only give me the sickest patient. And we just laugh and he says, I can't do anything with a healthy patient. Why am I here if only to take care of the healthy patients? And when it comes to these conversations that we're dealing with, they're difficult, they're unpleasant. It is hard to kind of deal with how are we going to implement these things, how are we going to face ourselves in order to meet the needs of others. But that is what you were built for. If you're here and you're a provider of healthcare, you essentially run towards the house on fire, not away. So that is par for the course when it comes to what you're able to do and what your capacity is and what you're called to do and what your purpose is. So I want you to kind of think about that when it comes to us looking at the short-term goals and the long-term goals. You can handle it, and I am very sure that we will be successful in handling this together. So thank you for your time tonight. I am always available. If you want to email me directly, call me directly. I'm available, and I'm looking forward to us continuing the discussion. So thank you.